But if you do have very dry skin, eczema, psoriasis, if you're going to do overnight treatments, when we think about severe eczema, one of the real game changers for many families of children with eczema, and I use this often for patients, especially if they have bad hand eczema, dyshydrotic eczema, maybe they work in health profession or in the cosmetics industry, they're having to wash their hands all their time and their hands are really affected. We do something called wet wraps. You soak your hands in some lukewarm water, let them absorb. And then we're going to do a series of moisturizers, right? We may use some medicated anti-inflammatories too, because inflammation is a huge part of this if it's eczema. But then we're going to layer things on. And the last thing we're going to put on is typically one of those nice thick creams. And one of the most cost-effective things, which I know, I'll probably get grief for as someone who's, a little more crunchy, plain old Vaseline is really well refined. I know there's lots of scare tactics out there, but if you are someone who is really sensitive, it can be a great cost-effective occlusive. And then you put some gloves on over top, old socks on if you're going to do your feet. I recently did this process with my heels because they were getting really bad in the winter, and do that overnight. And it's really, really beneficial.